The first clinical trial of the Buteyko method outside Russia was conducted here in Australia back in November 1994. And it was done in Brisbane at the Mater Hospital, and it involved 40 people with asthma of approximately similar severity. And the 40 people were randomly split into two groups. 20 of them attended a Buteyko course, exactly as we're going to do here over the next few days, 5 sessions of 90 minutes. And the other 20 people formed a control group. This is one of the standard ways that these trials are conducted. You have an active group and a control group, and you measure the results after a period of time. Well, the control group also attended classes of similar duration, 5 sessions of 90 minutes, and they were taught standard conventional health education and asthma management by a physiotherapist from the Queensland Asthma Foundation. 12 weeks after the classes had been attended, the results of the two groups were compared. And it was found that for the people who'd learnt the Buteyko method after 12 weeks, well, they had an average reduction in the use of their reliever medications of 96%. So most of the people were completely off the relievers. They also had an average reduction in the use of the preventer medication of 49%. And also after 12 weeks, the people who'd done the Buteyko course were experiencing on average 71% less symptoms. And they also reported significant improvements in quality of life parameters. The people in the control group on conventional management, well, after 12 weeks they had no significant change in relievers or preventers, no decrease in their symptoms, and they didn't have any of the sleeping or other quality of life improvements. Well, you'd be quite entitled to be sitting there thinking, well, look what happened back in 1994, how come we don't hear more about this? Well, the results were finally published December 1998 in the Australian Medical Journal. But when the preliminary results were first announced in early 1995, the initial reaction from the Australian medical and scientific community was very, very positive. In fact, the Australian Doctor magazine ran an article under the headline of "Doctors Gasp at Buteyko's Success." But despite all this initial positive support for the method, there was also a feeling in the medical community in Australia that, well, it was only a small trial. It's only the first time we've run a trial of this new method. We really need to do some more research over a longer period of time before we can make any changes to the management of asthma and sleeping conditions. So the call went out for more research. But here we are 10 years down the track, and there's been no other research of similar or greater significance in this country. And the difficulty that we've had in organising research into the Buteyko method is that in Australia, the vast majority of funding for respiratory research comes from the people who make the current system of treatment. And obviously we can't expect pharmaceutical companies to invest money in doing research trials on breathing techniques that might take people off drugs or stop them using machines. And why should they? That's not their business, that's not what they're in the game for. But sadly, none of the other groups involved in health and respiratory management in Australia have been able to come up with any funding of any significance for Buteyko, so the whole issue of research into the Buteyko method in Australia somewhat stagnated. Now, when that was obvious after this first trial by 1995, what then happened was that myself and some of the other people who had not only done the Buteyko course to improve their own health, but who'd also gone on to train as Buteyko practitioners, we formed an organisation called the BIBH. It stands for the Buteyko Institute of Breathing and Health. And we self-funded and conducted 3 other small clinical trials in Australia and New Zealand in the mid to late 1990s. And the results achieved for those were very similar to what I described to you for what happened in Brisbane. But the really good news is that there now has been a major clinical trial of the Buteyko method, a trial that went for a period of 2 years, and a trial that involved a total of 600 people. And that trial occurred in the United Kingdom, in Glasgow. And it's interesting that they were able to get such a big clinical trial happening in Glasgow because the Buteyko method didn't arrive there until 1995, 5 years after it came to Australia. But there is a little bit of a story to it.